And good day to you all. This is Brett Logie, ENCOMPASS Benefits Principal. Look forward to having you join us today. This is a recorded session for our benefits and pension education session, spring 2017.
The key here is how can we educate you to help educate your employees to be great consumers and wise pursuers of health and wellness. And that's really kind of the goal. Some of this information is a bit repetitive in the sense that we have talked about it before, but the question is, hey John, can I call you John? It's okay, Dr. Logie, Dr. Logie, the question is, this is what we've been sharing with our clients in the past. And the first one is the brand versus generic. And walk us through this a little bit, because we've been sharing with our clients that the generics are okay, they're reasonable, but when you actually prescribe a drug, is that come into your play in mind at all, and the difference between, and tell me what goes through the physician's mind as you're prescribing to the patient.
Good morning. What you're after when you get a prescription is the molecule that is active, whether it's in the brain or an antibiotic that's effective in your infected toe or whatever it is. What you're looking for is the active ingredient. The active ingredient is the molecule that is either harvested from some natural source, or more likely it's created in the laboratory. And so whether you mix that with this set of additional stuff like starch or a coloring or a capsule that you put around it or whatever, and then you put it under the name of Cefton, or the different laboratory puts a different color capsule on it and then you call it cefuroxime. It doesn't make any difference. The molecule is the molecule. So that's why the medical industry, if you want to call it that, certainly endorses the idea of using generics. There's no difference molecular-wise between the brand name and the generic. So this idea of automatic substitution between Lipitor and its generic equivalent really is reasonable. You can be allergic to any component. And so if a person is allergic to the wrapper or what is in it, the coloring and that type of thing, that is a possibility. And so we need to be sensitive to the fact that some people find that this one causes me a rash and the brand name doesn't. So in rare instances, that really is uncommon. More often than not, you get somebody who is on a brand name drug and then all of a sudden they want to continue on the brand name, but the generic, the patent has now been expired, and then they want to continue on their Vasotec when enalapril, the generic equivalent, is available, and your plan says that there's an automatic substitution. And they like the pink tablet. And so that's where the automatic substitution can be a bit of a problem. But from a medical point of view, I don't even get into this. All I do is prescribe the drug. Whether you prescribe the generic or the brand name drug, the plan decides whether or not there's an automatic substitution. I don't even get into that unless the patient comes back and says, can you check that little box that says no substitution? Well, we don't really get into that. But I can endorse the idea of the generic, because what I'm interested in is the molecule that is effective at the receptor site.
Is the drug samples in the marketplace. So I was talking with one of my doctors, and I said, do you get inundated with a whole bunch of samples from the manufacturers? Are they really pushing it? And you know, some of the historical stories, sending trips and that sort of thing, and how does that work from the physician side of things? And do you go through all your samples? Are there a lot of waste there? Do you prescribe a certain drug because you've been using the samples that come back and they say, hey, this is really effective? So talk to us about samples, because we've encouraged our clients in the past before to encourage their staff. Ask for samples, because it's not going to hit your benefits plan, and it's one of your cost-saving measures.
There are two sides to it. Number one is that the pharmaceutical companies do come to our offices on a regular basis. This is how they get their drugs into the hands of physicians, and then they put it on the prescription pad, and that's how the drug gets purchased at the pharmacy. I mean, it's a no-brainer, really. It's free advertising, because if the doctor puts the drug on the patient's desk there, and the patient says, hey, I got a box full of these, first 3 weeks of my prescription or whatever it is, the patient sees the doctor endorsing that drug. And so it's free advertising from the pharmaceutical company's point of view. It makes an awful lot of business sense from the pharmaceutical company's point of view. The difficulty with that is there a drug that will do exactly the same thing that isn't in that box? And that really becomes a dicey issue to try and push the patient to push away from the brand name drug when there is a generic equivalent or a completely different drug, because the patient doesn't know the answer to that. And so it's difficult to ask the patient to go to the physician and say, well, is there one that isn't a brand name that I can use instead of that one? But there is value in the pharmaceutical company coming and bringing those drugs and having them in the sample cupboard for us to choose from, because first of all, you want to be able to try a new drug, because these are truly new drugs that they're coming with. And I'd like them to take this for a week or 2 weeks or 3 weeks, depending on what the drug is and what its usefulness or what the indication for the drug is, before I write them a prescription for 3 months. That's useful, because if they come back and they say, oh man, that one gives me nausea or diarrhea or whatever the symptom is, you don't really want to write the 3 months, have them fill that prescription and then chuck it in the can. That just gets wasted. So that makes sense. The second usefulness from a medical point of view is that the pharmaceutical company is a good source of education for a physician when it comes to new medication, because as you can imagine, especially from a family doctor's point of view, which I would bet is where most prescriptions are written, is in the family doc's office, the field of medicine is so large, everything from neurology to obstetrics to all kinds of surgery. I can't keep track of all this stuff. And so when the pharmaceutical representative comes to the office and says, I have this new, for example, antibiotic or antidepressant, I would say, all right, tell me a little bit about it. He feeds me lunch so that he captures my attention, kind of like when Brett feeds you breakfast and captures your attention. And it's just a courtesy thing. It's kind of like having a guest at your house. You wouldn't have somebody over explaining something to you at your house and not offer them coffee and a cookie or something like that. So a lot of, you bringing up the issue of the trips, a lot of that is 20 years ago and before. The pharmaceutical industry has had its own people clamp down on the buying of physicians' time. So my predecessors would get fishing trips at five-star lodges in northern Alberta and Manitoba and stuff like that. Those days are over. But you can host somebody and provide sub-sandwiches and supper for them. So that type of buying physicians' time and their loyalty is largely a thing of the past. We should talk briefly, unless you were just going to talk about this slide.
Yeah. Talk to us about the couponing element.
So there are two issues. One is the drug sampling, and that is that every office, I shouldn't say every because I haven't been in every office, but the offices that I've worked in have a cupboard where you have samples, whether it's a puffer or a tablet or any other kind of medication. So I can actually give the person a week or 4 weeks of a medication to try. Then you often write a prescription, and you say, if this works well for you, fill the prescription. If it doesn't, come on back, and we'll have to find an alternative if there's some sort of reaction, tummy's upset, that type of thing. Couponing is not something that I've personally gotten into, but these things are certainly available where there's a copay in a person's drug plan, or they want the patient to get hooked on a brand name when there is a generic equivalent, that type of thing. And I don't know if you can read this. Can you read this from the back here? But if you look at, this is Merck's website here. And if you look through the names on here, you've got everything from Propecia, which is for baldness, to Marvelon, which is a birth control pill, Elicom, which is a very nice anti-eczema type cream, Fosamax for osteoporosis. I mean, there's a wide variety of drugs that Merck produces. These are common, everyday things that go on a prescription pad every single day of the year that you're in the office. And what they have done is taken sometimes that copay out of the way for the patient in order to get them to use that particular drug. And so there's a financial incentive for the patient to ask for that drug, or to get started on that drug and to stay on that drug, because it's really difficult to get a patient to switch from drug A to drug B, even though B is cheaper, if A is working for them. Now the interesting thing, if you're Merck, this is brilliant, because it is so easy to go on that website. And I would actually ask you, if you're in this, if this is what you do for a living, go on the Merck website and ask them for a card so that you can get a coupon and present it to your pharmacist. You will be shocked at how easy it is to get that. So it was a good exercise. I actually went on their website and put in, I didn't even have to give my name, my email address, or anything. And I get this coupon, and I go, shoot, I can bring this to my pharmacist right now. And it was really easy. So this is an issue. Much more so behind the scenes. Physicians don't, I wasn't even aware of this. But this is an issue, and it does promote, and you will notice that all of these drugs, Esotrol, a cholesterol medication, very commonly used. These are high use drugs, and pushing patients to use brand names.
So one of the things that we do for you is list the different drugs that are your top 5, and sometimes a report from the carrier, your top 50. So what you may want to do is look at your top 5 drugs, actually do a little research to see if they are available, and then in your annual, here's what's benefits world, here's the renewal, you may be able to actually say, by the way, just as a general education, you may be able to go and get one of these coupons. So not only is it available, there's active measures that you can take to be able to press into that. We're going to jump to the next section here, and that is forms. Okay, so you have employees that go and say, doctor, would you give me a prescription? Or a little note says, hey, I want to be off for 2 weeks. John, I would like you to address that issue, because if there's anything more annoying for HR managers, they get this little prescription pad that says off for 2 weeks. Tell us the background of that, because most of the time it's self-reported. And we're very frustrated with that, and we want to have more meat to it than just off for 2 weeks, off for another 2 weeks. And we need to be equipped with what we can ask, what we can't ask, and we'll talk about the medical forms first, and secondly, we'll talk about the larger forms second.
This is a dicey area because the physician is caught in the middle. I tell my patient who is sitting in front of me, I work for you. I do not work for him. I don't work for your employer. I don't work for your insurance carrier. I work for you. And I tell them that in the office. At the same time, I tell them I have to give them accurate information in order for me to be honest. Because if you come and say, can you explain this? Can you justify this? I need to be able to, in all honesty, go to you and say, yes, this was the problem. She had appendicitis, and I believe that it's going to take her 6 weeks off work in order to recover from that particular surgery. 2 sides. But understand that the physician doesn't work for you. The physician works for the patient. And so that's where the physician kind of gets caught in the middle. We want to give you accurate information. So my suggestion as a physician is have your own, if you want more accurate information, tell your patient that when they go see the physician, they should take this form in, make your own form. Ask specifically for the information, but I would give you 2 provisos in doing that. Number 1, make sure that you're going to actually use the information on the form to make your decision. Because I see multiple forms in the office all the time, and I say to myself, there is no way that some, no offense, non-medical person sitting in his or her office is going to have a clue what I just wrote. Now, do you have any idea what paroxysmal nocturnal dyspnea is? So if you ask me what the diagnosis is, and I tell you, and you say, what are the specific symptoms of this illness that the patient has that led you to that diagnosis? And I'm thinking to myself, what do you care? What are you going to do with that information? So 2 suggestions. Number 1, make sure that the information that you're asking for on the form is A, very simple. Diagnosis, no problem. Symptoms, physical examination, what are you going to do with that information? Don't ask for it. It's medical information. Now, if you're a part of a larger company and you have hired a nurse or a physician, in some cases, physicians are getting these forms, and there's a medical person go through the form and see whether, and hold the physician accountable for that 6 weeks for appendicitis, that's a different kettle of fish. My guess is that most of the employers, most of you in this room, represent companies that don't have a medical person on staff that's actually going to go through that room or that form. So don't ask for the information. It's just a little thing. The second thing, though, is for you, if you're going to require a form from the physician, pay for it. If you are going to require your employee to go into the doctor's office and request a note, ask for a little bit of medical information. And if you'd like some specifics after we're all done today about what I think a form should look like, and I'm not here to tell you what to do, I'm here to try to be helpful. If you want specific medical information to justify why the person got a note for 2 weeks off, that's very reasonable. Pay for it. Don't make the patient pay for it. That puts the physician in a difficult position. That puts the patient in a difficult position, because in Canada, we don't pay for medicine. And so if you throw this form at the patient, say you got to get this form filled out, and make them go to the physician's going to say, oh, another form. But if the physician knows that there is a $50 fee that goes with that, and you'll pay them $50 as soon as you get that form legibly filled out, then there's a lot less consternation on the part of the physician in filling the thing out. Make sense? That's from our point of view. If ask for reasonable information, pay for the form. Now, there are two kinds of forms. You've probably seen this form. This is the EI form. This one is about as bare bones as it can get. It looks like a full-page form. Most of this is demographic information. There's almost no medical information on here at all. You can look through this thing and see whether or not it can be used as a template for your business. I would suggest that this is too simple. If you're looking for a justification, you can't put a box on there that simply says comments. Well, what on earth do you want? I don't know. So this one's too simple. On the flip side, specific pieces of information that relate to a physical capacity to do your job, or for your employee to do the job, then ask for those specific things. Do you know who has the best forms in the world? Workers' compensation. BC Works, I think is what it's called, right? Go on their, what's that?
WorkSafe BC.
Thank you, WorkSafe BC. Go on their website. You can do it. We did it last night. You can download the PDF. It's very simple information. You can ax out the history and physical examination, because workers' compensation has to have that information because it's a permanent medical record on their side. They do have medical people working for them all the time. For your purposes, use the template of the bottom part that says this is what Joe can do and this is what he can't do and this is how long I expect it to last. Workers' compensation has the best medical forms.
The preventative health. And we had talked about continuing to educate our clients and really saying, is this the arena that we should really continue to be pressing into in the HR realm? It continues to be an element, I guess a buzzword, but what are we, is this an area that you believe that is important to press into in the next 5-10 years?
Excellent question, and overall the answer is absolutely. I believe that this is where you're going to get the biggest bang for your buck when it comes to helping your employees decrease your expenses when it comes to paying for your drug and benefit plans. I believe that this is number one. I think it's a win-win-win situation, and that's because if you are promoting the health of your employees, A, your employees are going to be healthier. That's a win. It's a win for the employee. 2, they're going to be off work less. That's a win for you. And 3, obviously whoever is paying for the drugs and the carrier and all that is going to have less drugs coming through it's going to cost less for them as well. So it's a win on all sides. I'm a big fan of this for a whole bunch of reasons, 3 of which I just mentioned. Just some ideas for you as employers or HR people in the office. How do you practically do this? Because you can say, oh yeah, we want everybody to be healthy and this type of thing. But if you want the drug costs and massage therapy and physiotherapy and all of the extended healthcare stuff costs to go down in the office, I believe that it is helpful for the employer to proactively promote healthy living. Now you say, well, of course. But if the employer actually shows the employee that it is important to the employer to live a healthy lifestyle with practical ways, and I'm going to get to suggestions in just a second, then it actually shows that you're willing to put your money where your mouth is. And through the back door, and the difficulty in promoting this, we can say, okay, generics cost 50 cents a tablet, and brand names cost $1 a tablet. I can measure that. And I can show you at the end of the year, we've used this many generics. We all in this world like to have graphs and tables and pies and things like that. This is difficult to measure. But when you're on the ground, you know that when your employee shows up in the morning, that's a bonus. When they're sick, that's a drag. When your employee is happy and healthy and those types of things, the whole office works better. So it's really difficult to measure, but in the long run, I think that this is where you're going to get the most bang for your buck in terms of how you can influence the patient. Well, from my point of view, it's a patient. From your point of view, it's an employee. Here's some specific suggestions. Have some health contests in your, you've heard of this, isn't there some sort of TV program, The Biggest Loser or something like that? Now, I'm not telling you to do that. Use your imagination and have some sort of health contest. Divide your employees up into half. Anyway, I'm not going to get into a whole bunch of that. Gym memberships. I personally, if I was an owner of a business, had several employees, this is one of the first places I would go, and that is to have some sort of incentive for them to go and do some physical exercise. Physical cardiovascular exercise is the #1 thing that will allow your patients to be healthier. How you do that, everybody's different. Some employers have actually put gyms in their offices. You can give your employees 15 minutes, 20 minutes, half an hour, whatever it is, of paid time to go and do cardiovascular exercise in the office. Now, that's pretty radical for some employers. But man, you're going to get a lot out of that, because in our busy lifestyles, it's very difficult when you've got lots and lots of things to do in and out of work to actually take that time. If you gave them that time, just an idea. My brother-in-law works in a large corporation who promotes health big time. And they have hired a significant number of people, and I'm not even going to get into the details because it won't necessarily be generalizable to this audience. Why not hire a dietitian once every 6 months to come in and talk to each one of your employees about how they can live a healthier lifestyle? Now, how you do that, whether it's individual or to all the employees at the same time, again, that's an individual company idea. But second on the list, first will be cardiovascular exercise. 2 is a healthy diet. And you say diet and exercise. Yeah, we hear that in grade 3. You're right. The reason we hear it in grade 3 is because it's true and it works. And if we actually did the stuff that we know medicine has told us is beneficial for us, and Grandma did too, we would actually be much further ahead. So that's just another idea. Here's one that I really like. If I was an employer, I would have you get 1 day for every month of sick time or something like that. Does your companies have something like that where you're entitled to 1 day per month? At the end of the year, I would say, all right, if you haven't used any of your sick time or have some sort of, if you've got leftover sick time, I'm going to give you 1 extra day of vacation for every, I'm just going to throw out a number, 3 days of sick time that you've got left over at the end of the year. You don't have to use it that way, but there's an incentive for them not to be sick, and B, to call in sick when they have a little bit of a cold. Now, there are legitimate reasons to be off work. If you get appendicitis, it's probably not a good idea to be at work. If you're having a baby, that's probably not something you want to have in the office.
Okay, we are going to turn to the last subject here. It's a very interesting topic, and we're going to have 2 segments on this, and that is on marijuana. Not that you've ever heard that word in the last couple of weeks or months, But this guy here, Jonathan Zaid, he's a university student. He started this trend a couple of years ago. University student was able to convince his employer and insurance carrier to cover marijuana on a medical basis. And just this week, 45,000 employees of Shoppers Drug Mart, a pharmacy company, Loblaws agreed to cover medical marijuana up to $1,500 per annum, which I find quite interesting as well. Now, the challenge with this is, I don't know if you read the local paper this last week, Capital News, clinical science proof lacking on marijuana use. Argument for legalizing marijuana from a health perspective is very weak, says the president of Doctors of BC. Dr. Rudiman says, while the harms associated with marijuana are well established, the research science behind the benefits of cannabis does not exist. And so, John, as you process this, we are inundated with pressure from somebody to move to accept medical marijuana on a fairly wide sweeping basis. And just a year ago, we showed this group a list of all the different areas that medical marijuana has been pushed into and prescribed for. I don't know, maybe you remember that. The question is, where is the counterbalance to this from your side of things, the specialists, the physicians, the medical research saying, hold the phone, wait a minute here, it's not proven, it's not tested. My doctor says there's like 20 different active ingredients in marijuana and they don't know which one is attributable to addressing which medical symptom and issue. Where's the counterbalance on this, and why are we seemingly only hearing largely one side of the issue? So talk to us about the medical marijuana first, and then I'm going to regroup on the recreational.
You can go on their website and get this document, and if you're really interested, this is unbelievable stuff. I totally agree with you, Brett. We've opened a can of worms with legalizing marijuana that is going to be very difficult to close. And the ramifications of this are enormous. This is what it says. Few reliable published studies are available on the medical benefits of cannabis. The amount of active ingredient in cannabis varies significantly depending on the origin. Cannabis is generally not appropriate for patients who, and then it gives a long list there, which includes just about everybody on the planet. This is a medical journal. And the title of it is Persistent Cannabis Users Show Neuropsychological Decline from Childhood to Midlife. Listen to this. Persistent cannabis use was associated with neuropsychological decline broadly across domains of functioning, even after controlling for years of education. And it's not reversible. If you have an 18-year-old in your household using cannabis for whatever reason, it is going to fry their brain. And it's irreversible. So why are we using it? First of all, well, there are two major reasons. Number one, if you have intractable pain and you're suffering from something like Lou Gehrig's disease or cancer, and the conventional narcotics, benzodiazepines, prescription medications aren't working as well as you would like them to, you get desperate. I can understand that. If you have a terminal illness and you want to use marijuana, I got no problem with that. When somebody comes in and they say, I really need some Percocet, if they're not half dead, and I say that respectfully, my default answer is no. You got to prove to me appendicitis, forgive me for picking on that one, or you get hit by a truck, then I'll prescribe Percocet for you. But in some jurisdictions, it was described to me, when Fort McMurray had its wildfires, the guys came from Fort McMurray, we're talking 80,000 people evacuated out of there. And this drug, Percocet, Tylenol 3, benzodiazepines, sleeping pills, muscle relaxants and stuff like that, the docs who received those patients, and obviously they lost all their prescriptions in transit. came and were asking my colleagues, I worked in these communities when they came, not when they came down, but afterwards, and they said, these drugs are food groups in Fort McMurray. If that's what's happening with triplicate prescriptions, highly regulated prescriptions now, what's going to happen with stuff that you can smoke, that you can grow in your house? So I with you, share a major, and so does medicine. The problem is that medicine, again, is caught in the middle because the push for this is not from medicine. You heard what the BC College is saying. The Alberta College is saying exactly the same thing. It's saying if you want to prescribe marijuana, you had better do really, really, really thorough documentation, etc. So they're putting the screws on us as physicians if we want to prescribe this stuff, which I don't, and I don't. The public is pushing this. Now, whatever your political stripe, our current Prime Minister ran on a platform of, I am going to legalize marijuana. And the Canadian public said, I will vote for that. So understand that this is not something that's coming from medicine. This is something that is coming from the general public. The public is pushing this. The people who voted for our current government have said, we want marijuana legalized. So that puts medicine in a difficult position because we've got this documentation. Now, what are the long-term consequences of it? We know that it causes lung cancer just like smoking does. We know that it causes COPD or emphysema just like smoking does. So, and we know also that it has this major influence on the developing brain, which is in part irreversible. So why are we doing this? Because we have two major pushes in our society. Number one is rewind the tape. Those of us that were around in the 60s, which I wasn't, by the way, I was born in the 60s, but anyway, you remember the push for sex, drugs, and rock and roll. Well, fast forward the tape 50 years, and here we are with a new generation that is wanting to do exactly the same thing. But now, we're going to actually legalize it. So on the public side, there's one thing. But secondly, we do have people with intractable pain, pain that is not treatable by any other thing. The problem isn't the people with Lou Gehrig's disease. The problem is not people with cancer. I'm sympathetic with that. You can smoke anything you want if you're dying of cancer, as far as I'm concerned. If you have chronic back pain, we got a different problem. If you have chronic migraines, we got a different problem. Because what's going to happen, and this is out of the Mayo Clinic, again, you can go on the Mayo Clinic website, punch in cannabis, and you're going to get this list. And this is what I would, one of the take-home messages is, marijuana is not a benign drug. And honestly, with all due respect for a Prime Minister for whom I pray, he doesn't know what he's talking about. When you talk about legalizing marijuana and making it available for the general public, you are entering a zone that is going to do some major damage to our society, and here's why. It says, use cautiously with alcohol. Anybody use alcohol in our society? I'm going to go through this quickly because it's 2 full pages, and you can see the type print here. Use cautiously may increase the risk of bleeding. Caution is advised in people with diabetes, people who have blood pressure disorders. Anybody have blood pressure problems? Cautiously in people with liver disease. Cautious in people who are on estrogen therapy. Well, guess what the birth control pill is? It's estrogen therapy. Cautious in people with immune disorders, history of drug abuse or addiction. There's nobody that uses marijuana that has problems with drug addiction, is there? Sorry, I'm being a little bit sarcastic. People who have a risk of eye problems, people who are at risk of seizure or those using anti-seizure medications because marijuana may cause seizures. Use cautiously in people who have or are at risk of heart disease. You gotta like that one. Marijuana can cause abnormal heartbeat, disrupted blood flow to organs of the kidney and spleen, heart attack and heart failure. Use cautiously in people who have learning disabilities, ADHD, because marijuana, get this into your office, may cause problems with attention, learning, memory, organization, planning, problem solving, and other brain. You want somebody working in your office that's got that problem? Use cautiously in people with a risk of skin problems, people with stomach disorders, people who have risk of musculoskeletal disorders. Use caution in driving. I could read all of this, but this is the one that really caught my attention. Use cautiously in all otherwise healthy people who are not taking any medications. I got 1 minute. In other words, this is a dangerous drug. I think there are two categories of people that are wanting to use it. Number one, if you are dying of cancer and your pain is not able to be controlled by a narcotic or any of the other medical stuff that we conventionally use, I'm sympathetic with that. I don't know if I would prescribe it, but at least I'm sympathetic with the idea. Then we've got this whole other category of people that have chronic pain from whatever. If you have rheumatoid arthritis and you're crippled, or you have multiple sclerosis and you can't function, I can kind of understand that. Those are not terminal illnesses per se. Those are chronic diseases. But if you're talking about a 25-year-old with back pain, that's a different kettle of fish. And I think we really need to be really careful. And I would push back on carriers, push back on, and you can call your legislators and help us out, because this is not coming from medicine. And you can tell your elected officials that medicine is not very happy about the way that this is happening. And I'm only one physician, so I do not speak on behalf of all of my colleagues. But the push for this, as you can hear from the BC College guidelines there, and the Alberta College is similar, that we're concerned about this as well. So I think that we need to be educated consumers, though, and just because my neighbor is doing it doesn't necessarily mean that I have to do it. It's a difficult situation, because what the proponents are going to do is they're going to parade 1,000 guys like your son, and they're going to say, well, this works for me, well, this works for me, well, this works for me. But you know what? Does it work for the society? And I think we need to look at the bigger picture. Fentanyl is an absolutely fantastic narcotic analgesic. But do you want your son taking fentanyl? Well, we know what the results of that are on a societal basis, don't we? Now anyway, I don't want to get into the political side of that thing. We will not be able to solve this issue this morning. But if I were an employer, which there are some employers, for example, in the oil patch, they have regular drug screens done. And if you have marijuana in your blood, well, they do a urine test. But if you fail that, there is a zero tolerance. I don't know why, if your company depends on somebody having good cognitive and your business is depending on the cognitive abilities of that employee, and they are taking a mind-altering drug, you have to decide whether or not a drug test is of value to you, because it's a big issue. How many of you are basketball fans and have been watching the Golden State Warriors? Golden State Warriors are one of the best NBA teams in the U.S. right now, and their coach, Steve Kerr, is off because of symptoms of post-operative symptoms related to back surgeries that he has had recently. He was not able to be on the bench even though they're in the middle of the playoffs. That only to say, he came out and said, do not submit yourself to something like surgery for your back pain. Now, this is his particular opinion. I'm not saying he's correct, and I'm not saying that his situation is generalizable to every single patient. But he's saying, I would encourage everybody to try and avoid surgery and use rehab, rehab, rehab. Now, that's what he was quoted as saying. So, again, are there patients with intractable pain due to chronic conditions that are exceptions to the rule? Concern. We have generalized this marijuana thing to an entire population without the medical backing for that, and we want to legalize me being able to have marijuana plants in my house when we know what the medical side effects of that are going to be, when there are difficult, but I do believe that there are other solutions. Short-term pain for long-term gain is the mantra that I would propose. Are there drugs without side effects? It's called placebo. So the answer is no. I mean, obviously there are no drugs, but I think we have to look at the long-term implications of this. That's my encouragement. Yeah. It's very difficult to answer the question. I agree with what you've just said. There's a medical side of this, and as much as we talk in medicine about preventative health, I don't get paid to do preventative health. I get paid to fix people who are already sick. And so medicine doesn't do, very frankly, medicine does not do preventative health very well. But on the societal thing, you asked the societal question. Obviously, I'm not going to be able to, solve that one right now. But from my personal perspective, your question has delved into a much larger issue, which partly is societal, but I would venture to say that it is partly a moral question as well. Because when I see my government in Alberta paying for naloxone kits, when I see my Alberta government paying for safe injection sites, we've all of a sudden crossed a moral boundary where now I am not just trying to get these people into rehab, I am actually helping them inject a drug that is illegal. We've also crossed a line when we're talking about physician-assisted suicide. So are there moral implications to this entire discussion? The answer is yes. It's a huge topic, so I'm not sure we're going to be able to give you the specific answers. I'm not sure there are any specifics other than to say that we've gone into not just, this isn't medicine anymore. Medicine has the drugs and, and that type of thing. But what got the person to that? You're talking about society, and you're talking about morals. And
great answer. Good. One last question. This is for the shy character. Waiting. Are bad. Thanks, Joy, for recommending the WorkSafe BC site in the Return to Work section. Thanks very much, John. Really appreciate that. Let's show our appreciation. We're going to have an interesting discussion at dinner tonight, I'm sure. So that's great. Megan, come on up. We had also wanted to continue bringing additional new information to this group with respect to benefits. And in every renewal document, we create our own templates. We don't just put our cover letter on top of the carrier's renewal document and say, here you go, let's walk through it. But we research from all the different carriers across Canada, pull together the trends and information that is relevant to you in a kind of a Cliff Notes narrow scope. This year, our renewal document is actually quite large, largely due to Megan and her great research team. But the key is, during that renewal time, we're going to encourage you to go back and read it later. But Megan wanted to highlight a couple of key areas for us today on group insurance trends, and then we're going to take a quick break. Thanks.
Good morning, everyone. So at ENCOMPASS, our first priority is to represent you, our clients. If we're not up to date with the trends in the industry, then we're not doing that. Every year we do extensive research, as Brett mentioned, in the group benefits industry. With this, we create the trends section in our renewal reports. This year, our 2017 renewal reports were a little bit more extensive. It was also our first year that we added human resources trends, which is a passion of ours as well. So make sure you keep an eye out for this section in the reports this year. So let's take a look at disability and mental health. Did you know over 500,000 Canadians will miss work this week due to mental health issues, costing the economy over $50 billion a year? Mental illness is the leading diagnosis category for short-term and long-term disability claims. Disability claims related to mental health have a longer duration and a more complex and lengthy treatment. And that 77% of employees fear talking to you, the employer, about their mental illness. The Mental Health Commission of Canada has developed a new national standard in Canada for the psychological health and safety in the workplace, and is challenging employers to adopt this new standard. To accompany this, there is an employer's action guide called Workplace Mental Health. So you can get this booklet online. The goal of the Mood Disorder Society of Canada is for employers to create a mental health safe workplace to support their employees when ill, but also to attend to the employer's bottom line. We'll make sure to send you a link of this book after the presentation. This year, one of our trends within the industry is also health and wellness. Many employers are focusing on strategies on health and wellness in the workplace, hoping to reduce disability claims, extended health claims. Some initiatives in these areas are education, support, and training for managers and employees, employee assistant programs, health risk assessment and wellness coaching, healthy living or lifestyle accounts, including gym memberships, targeted wellness challenges, employee and recognition programs. Your advisors can help you implement any of these and more. Now let's explore chronic disease. Did you know almost 60% of plan members have at least one chronic disease? The top 3 are high blood pressure, high cholesterol, and depression. For the first time ever in Canada's history, the number of people over the age of 65 exceeds those under the age of 15. Baby boomers now make up 31% of the workforce, and our trend shows that chronic disease is common in workers over the age of 50. Plan sponsors often underestimate the prevalence of a chronic condition and the financial impact to the organization. Employees that have a chronic disease often have lower productivity, they'll miss work, have higher drug and extended health care claims, and have more disability claims. So how do we manage chronic disease? Decisions will need to be made about investing in proactive and preventative health and wellness strategies, encouraging increased medication adherence, employee education, and preventing and managing chronic conditions, and even plan design changes. There are many factors affecting the cost of a benefits plan, but we are constantly seeing the extended healthcare rates steadily increase. I have a quote from an article written by Brett Logie recently that was published in the HR Directors magazine. The article is based on fixing an unsustainable benefits system, and it looks into long-term action plans and creating a stable group insurance plan. He says, for the last 10 years, your Canadian group insurance plan carriers have been estimating their annual adjustments for extended health care rates will increase anywhere from 8 to 15%. Why have we put up with this? Is there an obligation for us just to raise our eyebrows and say, okay, at what point does this become an undue hardship on us as employers? What I see as a benefit support specialist working on your renewals is that this is getting worse. We're seeing more and more high-cost biologic drugs showing up on plans, and insurance carriers are increasing drug rates and the pooling charges to accommodate this. As disabilities and chronic conditions become more prominent, so do the cost of medication and other methods. Paramedical services and massage therapy and chiropractor have recently become just as popular as maintenance drugs to treat general discomfort, sore muscles, chronic pain, and other diseases. This year alone, we've seen usages up to 200% increase in paramedical services. With the increasing cost of usage, and the important question is, how do we manage these costs? There are many ways of managing these costs, but employee education and awareness is the most important. So what strategies are you planning on implementing for cost containment and plan sustainability? If you want more information, talk to your advisors about any of these topics or the sections as you get your renewal reports.